Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Next, mechanism of action of sodium nitroprusside is by stimulation of guanyl cyclase. 50-year-old man with malignant hypertension. The drug of choice for malignant hypertension is sodium nitroprusside. It is the first line of choice for hypertensive emergencies. Maximum incidence of impotence is seen in which of the following antihypertensive drugs? Impotence is maximally seen in beta blockers. Which of the following is not given in pregnancy? ACE inhibitors and ARBs are not given in pregnancy. They are contraindicated in pregnancy because of their teratogenic effect. Following about hydralazine is not true. Hydralazine has direct relaxation of blood vessels. True. How does hydralazine relaxes the blood vessels? It releases nitric oxide and it also opens the potassium channels, and thus it will relax the blood vessels, and once it relaxes the blood vessels it causes arteriolar dilatation. It mainly causes arteriolar dilatation. So it causes dilatation of both arterioles and venules is false. Hyperpostural hypotension is not a common problem. True. It increases plasma renin activity. So this is false. It causes dilatation. It does not cause dilatation of both arterioles and veins. It only causes arteriolar dilatation.
thank you and thank you for watching.